Hi, my name is Franco Cavallari of Biologic Pharma Medical. I'm here today to talk about ketosis, ketogenesis, and the ketogenic diet and how they relate and what these terms mean and how we use them to induce beneficial effects in the body. We know that, for whether it's for fat loss, whether it's for cognitive support, or even to treat in part or in whole epileptic seizures or the frequency of epilepsy, people have engaged in what we call the ketogenic diet. And it's becoming real popular for weight management and the treatment of diabetes along with obesity. They usually go hand in hand, type 2 diabetes in particular. But the ketogenic diet is made up of a diet that is low in carbohydrate sources, high in fat sources, and low to medium in terms of the proportion of protein intake. Now, the carbohydrate intake should be much lower even than 50 grams. Can't really go over 50 grams. You start to hit 40, 50 grams a day in carbohydrate intake, and you begin to then override what we call the ketogenic process. Now, ketogenesis, or the ketogenic process, is the name we give the process that makes ketones in the body. So if you go on a ketogenic diet, within hours, you begin to produce ketones through what we call ketogenesis. And that ketogenic activity occurs primarily, and some other cells in the body, but primarily in the liver. And it occurs through what we call beta oxidation. And what happens in this case is that the liver is taking fat and converting it into this water-soluble, aqueous-soluble ketone, a small molecule. Why does it do that? The reason is that your brain can't survive without glucose. It needs glucose. That's not entirely true, but I'll get to that endpoint in a moment. So the brain cannot use fat as a source of energy, a substrate to make ATP. So your neurons can't use fat because fat can't cross the blood-brain barrier very effectively. And most research says at all. So what happens when you go on this ketogenic diet, low carb, high fat, and you limit, in part you try to overall limit your caloric intake as well. Your peripheral tissues in the body, the tissues in the body, can use fat as a primary substrate for energy. It's not a problem. But it's the brain that can't. It's your brain that tells you you need carbs when you go on that low carb diet. And it's hard for people to stay on the low carb diet because the brain says, I need food, I need carbs. You're not feeding me. Because it takes about 48 hours to 72 hours for most people to make enough ketones to cause serum ketone levels in the blood, to rise high enough so that the brain's getting ketones at levels that make it happy so that it can make energy. And once that happens, then you feel good. You can be on that low carb diet once you get enough ketones in your bloodstream, ketosis, because an elevated level of ketones we call ketosis, increased serum ketone level. Ketogenesis is the process by which we make ketones. The ketogenic diet induces ketogenesis to induce then ketosis. And we need that ketosis in order to serve the brain with an energy substrate that it can function with. And when that brain gets these ketones from the ketogenic process, then your brain is really happy. It can actually produce more energy typically with less oxygen than it can with glucose. So that's a bonus because typically people on a ketogenic diet, once the brain has had enough ketones, they actually feel like the room is brighter, that they're cognitively sharper, and they perform better. So that's the difference between and the definitions of ketosis, ketogenesis, and the constitution then of the ketogenic diet that induces ketogenesis and then ketosis.